Hi guys, I'm coming in here. My eyebrows look a little bit funny to answer a question for a beautiful woman in our community who just got a positive pregnancy test, which is super exciting. First one after a miscarriage quite a few years ago. So there's obviously some underlying issues when we're dealing with fertility issues. If you guys have not looked at the fertility line talk, I highly, highly recommend that. And so I'm going to come in here and try to relieve some worry. But I couldn't type this out because it's just, you can see I'm tongue-tied. Okay. We got some test results back from a thyroid panel with pretty high antibodies, tipping close to Hashimoto's. Now, when we're dealing with thyroid issues, we're dealing with them for years before the doctors will run these type of tests. And it's usually not until you are really pushing or presenting with symptoms, or if you luckily get hooked up with a fertility expert that will run a full thyroid panel for you, because you can present with very kind of normal and common health issues for a really long time. And then all of a sudden you get these results back that, holy shit, you're like on the border of having Hashimoto's. The great news is this is all reversible. The bad news is not quickly. It doesn't happen overnight. And when you are pregnant with, let's say, known high antibodies, which a lot of the times, if you have high antibodies around your thyroid, you have high antibodies other places, which hence the unexplained infertility or the reoccurring miscarriages. High antibodies in the thyroid indicate high inflammation. This can come from leaky gut. This can come from mental and emotional issues. And unchecked, it just gets worse and worse and worse. Presenting kind of normal and having unexplained infertility is a symptom, right, of issues. Low progesterone levels, I know we're dealing with that as well. And thyroid problems absolutely can disrupt your thyroid or your progesterone levels. Okay. So obviously the formula takes you through all the steps to reverse all these issues. It's very, most people need to do the same things, but just directly like towards them, right? Everyone needs to fix their diet, but what foods are you intolerant to and what foods aren't you, right? That's where you get specific. Everyone needs to fix their stress levels, but how? What do you resonate? What are kind of some of the underlying causes of it? Do we have some trauma that we need to work through? Is it like the stress we're going through in our work right now? Is it both? Is it the stress of infertility? Highly likely, right? Okay, but when you are pregnant, there's not a quick fix to dramatically lower those antibodies unless you're working with a fertility clinic that will give you immune suppressing drugs to lower those antibodies that might affect the embryo to not get rejected by your body. But usually like first you need to be underneath that care. First, you need to be having a doctor that will be willing to do that for you, understands that science, believes in it. A lot of people don't even believe in it, but it usually starts before the pregnancy. You usually have to quiet down your system, and then they do it until the placenta takes over around 12 weeks. Yeah, so that is a question that's like the only thing that I can think of right now, is that when you're pregnant, if you are working with a medical doctor that can prescribe you that type of medication to help increase the chances of, continuing the pregnancy, that's the only thing that is like, quote unquote, that you can do right now that would instantly fix it or support it. I don't want to say fix it, but just like have an impact. All the things that we do on a holistic and a functional side is just healing the body. So there's no quick fixes. So this is, with the food sensitivity test, whichever one you took, I don't know what type, if it's one that I would necessarily agree with, if that makes sense. Like there's one you can do over the counter, they test IgG, and it's just not a good representation of your food intolerances. Just go with that right now, right? That's like all the information that we have, just go with it. If you want to do the MRT test right now, you can absolutely do the MRT test. It's a very quick turnover. So meaning you order it through me, I order it the same day for you. The testing company gets it out like instant out that day, depending Hawaii to Florida time zone type of thing. You get the blood draw at your convenience, and you get the test results within a week, if not sooner. So it is a really quick turnaround, and you can use that. But once again, that isn't an instant fix, in meaning that, yes, it's great that you lower those food intolerances and that inflammation, but your body still has to heal from the kind of damage that was happening for years prior, right? And then on top of that is the stress levels too. It's the endocrine system, it's your hormone system. For me, and what I talk about a lot, that's one of the hardest things to do. Like diet was quote unquote easy for me, and especially the more I worked on my mindset. But like dealing with the looping system of like stress patterns, right? Like the overthinking, the overachieving, the worrying, all those things, they just take time to unlearn or reprogram. So in early pregnancy, other than the medical support that could happen, the holistic and functional stuff is really like, I feel like I can't even say this because I know, like my my fourth pregnancy, my second live birth I got pregnant 2 months after the miscarriage, and that miscarriage was still completely like in my mind. And on top of that, I got pregnant naturally, so I had no medical support, which I thought my body needed, right? And I had a really big bleed at 9 weeks, and it ended up just being, I have a heart-shaped uterus, that my little baby was sat here, and my lining shed from that side. But like, that's not what I'm thinking, right? Like, that's not what's going through my head until we got some answers with sonogram and stuff. But what I'm saying is that, like, when you practice these mindset, when you are working on reducing all those stress levels and making new loops and new connections, it does not protect you from like shit happening and you having to deal with things. You just go through them with a little bit more grace, and that grace gets bigger and bigger the longer you work at it. So it's hard to, I know how hard it is for me to sit here and be like, okay, you need to just take care of yourself, reduce the worry, stick to the diet. But I know that it is going to be like nail biting, right? And it's hard. Like, you just can't switch it off. So my best advice right now is do the things that you can control and then you can do to lower the worry, lower the stress, rest and relaxation. Obviously, try to stick to the best diet that you feel comfortable with right now. And know that I truly believe that most pregnancies are written in the stars. So meaning that when you get pregnant, there's little to nothing you can do to make or break the pregnancy. right? Your body is already in the shape that it is right now. You can't dramatically change that. Even using immune suppressing drugs or any kind of drugs to help is not guaranteed. Both of my miscarriages were medically supported. So it's really tapping into just being here now, celebrating the pregnancy, being as happy as you can be, and know that whatever the outcome is, it's just like a shitty thing like to say, isn't it? It's written in the stars and it's part of your journey. How, like, I know it's really, really shitty, but that's like all we can do right now. So I hope that helps. And maybe turn this off, this part, right? This is for people who are listening to this in the community, and eventually this goes out onto the podcast for wider support, because this information needs to be out there for everyone. So I want you specifically to turn this part off, and maybe come back to it when we're just in a better position, okay? When my clients are dealing with reoccurring miscarriages, and I know this miscarriage was a long time ago, but my honest advice is to use protection, because when we're looking at the fertility line again, is you're hovering here, right? Like you're getting pregnant, but you're not staying pregnant. And sometimes you're like just like below this line, maybe hovering it. When we're using holistic and functional support, you are going to raise your fertility, right? But I don't know where the line is to stop the reoccurring miscarriages. It literally might be here, just above. You might need to go higher. So when you're still trying to conceive and kind of in that desperation and lack, like, well, I can't stop trying. What if this month is the month? You're actually putting yourself at a risk of having another miscarriage. And I've seen this with clients. Like if you go back into the formula and watch the replays, if you're a community member, we talk, like, people get pregnant. I have a one-to-one client that right now, she got pregnant over Christmas, and it was like this crazy unicorn pregnancy after like a crazy shambles of an IVF that like put her in hospital and stuff. And it just, like, the health just isn't there. So it's really important, and I know it's hard. I know it's hard, but to just take some time and really focus on your well-being, your health, your healing phase, your mental, emotional phase. Give it a few months. I know there's a minimum 3, if not more. And then when you come back to trying to conceive, you can dramatically lower the chances of having another miscarriage or other issues. Because what you're doing is you're not only lowering those antibodies, you're also increasing egg quality, hormone health, lining, all the things that you need to do to maintain and support a healthy pregnancy. Okay, this was a hard one, but I hope it helps, and my fingers are crossed.